glomerulonephritis is a condition in which you can see it has nephritis in there. So what's affected already? Kidneys. Kidneys are affected. Now, for glomerulonephritis, very often it is a child, but it can be an adult. What I want you to do at the top of this page is I want you to write antigen, antibody response to strep A. Antigen / antibody response to strep A. If you were here in toe-to-toe this Saturday, you know that. You also know the classic hallmark symptom. What is it? For those who was here. Tea-colored urine. You better know that. So for this patient, tea-colored urine is the classic hallmark symptom. Now, I always have you put a little triangle, and it really helps you. Don't we call it triad, y'all? So at the upper right-hand corner, a little small, don't make it too big, it ain't that serious. Make a triangle, y'all. Make a little triangle over there. And here's what I need you to put. I need you to put tea-colored urine. And don't be so ridiculous with it, okay? Because I can't take y'all when y'all be absolutists. It didn't say tea-colored urine on mine. It said smoky. It didn't say tea-colored, it said coffee. It didn't say tea-colored, it said rust colored. It ain't yellow. So tea, rust, coffee, smoke, I don't give a shit. It ain't yellow. It's something wrong. Okay, so tea-colored urine is a good one to know. It's number 1. It's called classic hallmark. And then put this on the side. If I say the patient has a high blood pressure, what else they got? Headache. You want to say it with y'all chest? Headache. Oh, okay. Okay, now at the bottom, y'all, keep this. History of a sore throat within the last 3 weeks. So what is that? Strep. Whether they went to the doctor or not, that's probably what it was. One of my little babies was in college when she got this. She had finals. She wasn't finna go to no damn doctor. She didn't like the campus health services. So she was like, bump that. I gotta get through finals. I'm in nursing school. Can't miss no days. Got to be on campus for that. So she was like, okay, I know what I'm gonna do. The sore throat is driving me crazy. When I get done with finals, I'm gonna go home and get it together. Go to my regular doctor. How long do you have to wait before you get in trouble? 3 to 5 days. You sitting around with that sore throat 3 to 5 days, you too can have glomerulonephritis. And that's exactly what she got. Glomerulonephritis, untreated, undertreated, delayed treatment of strep. Untreated, undertreated, delayed treatment of strep. Okay? Now, you know if your kidneys ain't working, you're going to have a fluid volume overload. You know if you have fluid volume overload, your blood pressure go up. You know if your blood pressure go up, you're going to get a headache. That's all they're saying on here. You know if you got fluid volume overload, you're edematous. You know this. We can keep it moving, really. So look at it. You didn't gain the weight. You're edema. You got everything wrong. What I say is always a sign of kidney failure. Protein in the urine. That's on here. Kidneys are failing. You don't make urine. That's on here. It's called oliguria. What is the tea color, rust color, cola color? What is that? Blood. Hematuria. It's on here. It makes sense. Don't be acting crazy. Brand new. Okay? Now, what I told you to write at the top is in a box right here. Antigen, antibody, group, strep infection, complex from recent strep infection. What kind of strep? Strep A. What is low? Glomerular filtration rate in this box. Low glomerular filtration rate. Highlighted. The patient may be pallor. The edema is around the eyes. It's called periorbital. Periorbital edema. Now, what you're going to do with this patient? Well, You're going to monitor their blood pressure. You may have to give antihypertensives. The patient's on bed rest. They're going to need immaculate skin care because swollen skin breaks down. If I was real puffy and I did this, I would tear my arm skin, the skin of my arms. So I'm real swollen and I just did that, I would literally tear my skin. I would tear it. It's so easy for them to get a pressure ulcer. Very edematous skin needs skin care, immaculate skin care. Patient's going to be on diuretics, steroids, renal diet, and often we give this patient Bactrim. What kind of pain they got? Where is it at? Flank, better be your word. Flank pain. Patients at risk for this, lupus and sickle cell disease. Patients with lupus and sickle cell are at risk for glomerulonephritis. Okay, at the bottom of this page, I want you to write nephrotic syndrome. We only have a couple of notes. Nephrotic syndrome. This is more chronic. It's very much like glomerulonephritis. That's why I want you to write on this page. It's just like it, but it's more chronic. With nephrotic syndrome, the difference between the two is that nephrotic syndrome did not have a strep history. There was no strep throat in the history. What there was a patient who probably has an autoimmune response. Autoimmune. This patient will literally waste protein and a ton of it. Their albumin will be very low in the blood. Instead of the renal diet the way it is, they need high protein diet. High protein. Remember, renal diet is low protein. Who else needs high protein, y'all? Dialysis. Before dialysis, low protein. With dialysis, high protein. So you get two people need a high protein diet, nephrotic syndrome, and you got this dialysis patient that needs a high protein diet. Dialysis, high protein. Without dialysis, if you just got kidney failure, low protein. The patient with nephrotic syndrome has a high cholesterol. The treatment will be steroids. Okay. Turn the page. You should have a picture like this that says fun, okay? At the top, highlight prostate and put this. Benign, prostatic, hyperplasia, benign, prostatic, hyperplasia, BPH, right, y'all? Now, look. The prostate is confusing to most nursing students, unless you know the anatomy of the male. So if you laugh, I will shoot you in your forehead. So we have to know the anatomy of the male. So you are going to be treated with my delightful artwork. Shut up. Shut up. I hear your ass. Oh, shut up. Now, sure, veiling bulbs, urethra, prostate, mirrors the anatomy on the outside. Anatomy on the inside looks suspiciously like the anatomy on the outside. That's how I want you to remember it for this test. Because you have a full bladder, full of urine, you're going to get a reflex. It's going to let the urine out through the urethra, and you're going to pee. That's what should have happened. But your patient is not this man. Your patient has this. His prostate is enlarged. Now, what we have to remember is that if you look at every 85-year-old male in America, they all have BPH. So as you age, it's quite frankly a little normal to have a little BPH. My husband is crazy, you know that. So I find, coming downstairs one day, they're in the kitchen eating breakfast, laughing hysterically about a conversation that made me cringe. The boys, remember I'm not used to boys, married him, I got 3 now. He got 3 boys, I got 2 girls, I'm a girly girl, and they're definitely boy. So they're talking about the day they had a pissing contest. Dad, you remember we were hanging out on the deck and we were trying to piss on the tree? Remember you lost. Think it through. They're teenagers. Their stream was very forceful. It hit the tree. Poor Charlie, he's older. We're old as shit. We're 50-ish. So when he went to go pee, just kind of peed. It didn't come up on the tree. What's gonna happen like that? Okay? When Charlie gets 80, it'll probably dribble. Okay? I don't know, you know? So what we're doing is we're getting a prostate that's getting bigger each year we get older. And what is it doing? It's occluding the urethra. It's pressing on the urethra, narrowing the opening. So when this guy gets such a large prostate that it's no longer acceptable, and that's rare, right? You do get a few guys like that at their earlier years. Most of them are much older, right? You're gonna get these patients all the time, by the way. But when we get a younger guy, you know, he's in his 60s, he's talking about he's dribbling. Don't forget that word, dribbling, it's on your sheet. He's dribbling. It's like I get up at night, I get up at night more than usual. I gotta strain to get the urine going. I gotta really work at it to keep it going. That's all BPH. So when you have that guy, all of this urine does not necessarily come out. Doesn't that make sense? So what does he get? Urinary retention. He gets urinary retention. Okay? So bottom line, as we age, it's normal to get BPH. But some men will get it sooner, and it's much worse than others, at which point we need to do something. Now, there are herbs that actually work. Because you know me, I'm all about think outside the box. You're straight American, you're going to be on some drugs. You need to think about what other people in other countries are doing. Saw palmetto works. You better know it. Saw palmetto works. It's on your medication packet, you know, the one you never look at, where the herbs are, you know that one. Okay? Now, risk factors for BPH, same shit, different day. Hypertension, obesity, typical American diet, you know how that is. Diabetes, atherosclerosis. So basically coronary artery disease, right? It is more common in African American men. 50% of everybody 60 years old and older will have a little bit. Half of men 60 years old and older will have a little bit. Now, so we're going to try some natural things first. We call that basic care and comfort. We want this brother here not to be doing caffeine, because the bladder irritant, all this nonsense makes no sense. So we don't really want him doing caffeine. We don't want him drinking too late at night, because it's going to be getting up all night. It's going to affect his sleep pattern. So we try to say cut it off around 8 o'clock, decrease your fluid intake at night. You got to retrain your bladder. We do this with our elderly patients. We have them go void every 2 to 4 hours. If they're young, probably more like 3 to 4. If they're older, every 2 hours. Bladder training. Retrain your bladder. Gotta get it to work. Okay? Double void. What does that mean?
They go once and then they gotta go again.
Go once and they need to purposely go again. Because it's still there. Here's a novel idea. Take your ass to the gym and lose some weight and exercise. What does exercising do? You said it earlier. What does it do to the vessels? Vasodilate. More blood flow to the organs, make the organs work better. Losing the weight makes perfectly good sense, because when you are a heavy person, you put more pressure on the urethra. Doesn't work so well. Causes you to have these symptoms. And I do want you to know we are dribbling. Okay? So you see the picture. He's dribbling. You got to know that word, dribbling. It's none of that ball. It's pee-pee. Now, what will happen with this patient as they get older and it gets worse? Look at the bottom. They can get increased UTIs. Infection, you see that? Okay. Now I'm going to use this page for prostate cancer too. So BPH, boom, we're done with that. Let's do prostate cancer, shall we? With prostate cancer, go to the word hematuria and put painless. Well, I should look that up. Put painless hematuria. If a man is peeing and it's pink or red and it does not hurt, that is a red flag for either prostate or bladder cancer or kidney cancer. Painless hematuria. What I'll teach you about cancer, most of it's painless. Painless hematuria is a really, really big deal. Now, we screen and we can diagnose. If we're screening a gentleman for cancer of the prostate, when should we start? What age? 40? 50? 50 for Caucasian, 40 for African American. Know your culture. 50 years old every year for the Caucasian male, 40 for the African American male. Now, so when we screen, how do we do it? What is a screening for prostate cancer, everybody? You said what?
PSA.
Is she right? PSA? Raise your hand, don't be a punk. One person thinks she's right. Shut the fuck up. We're gonna try this shit again. Raise your hand if you think PSA makes sense. Shit. Read, damn it. Okay, she's right. What do you think is the way to do it?
In the shower.
No. Here. But I ain't mad. My baby disagreed. She was a little older out there. Digital rectal exam. Why do I make you raise your hand 3 times? Because it must be on a test somewhere in the universe. You have to know this. Digital rectal exam. Now, honestly, Your man on some bullshit, like my man. He is not willing to volunteer for you to go up in his ass. Got a lot of men out here ain't trying to hear this, are they? That's the problem. Because let me tell you this. Because see, wives, we got it going on. We got power. We sitting on gold, man. We can make our men go. I don't know what you're doing with the shacking up and shit. Don't talk about married women now. So here we go. Your man on some bullshit, don't want to go for a physical. You a nurse, make buku bucks, and got health insurance, so he ain't got no excuse. But he on some bullshit. Y'all feeling me? Unfortunately, if he would just go, we could prevent almost all prostate cancers. There would be no death from prostate cancer if he would just go. So, what we gonna do? We have to remember with this precious man that we can teach him, and if it don't work, we got powers in other areas. Now, I told man, you better go. I bet you better go. I didn't want to hear this. I ain't even trying to hear this noise. You gonna get that colonoscopy and you gonna get this damn shit you're supposed to have every year. Now, why y'all, why? Because if we catch it early, the treatment is so easy and their life is so full. It is so easy to treat this shit. All the little horror stories they heard are wrong. That was from 40 years ago. There are way better ways to do this now. They just have to go. If they go, we can catch this shit real early. Now, my dad went early. Needless to say, I'm a bit empowering. So he went early. He is 78. He has survived prostate cancer already 40 years because he went early. Why should the African American male go earlier? Because he has higher rates of prostate cancer. He just does. His testosterone is higher. This is based on a high testosterone level. Why is a digital rectal exam better than a PSA? Because I can literally feel cancer with no problem when I do this exam. I can feel it. It's so easy to feel, but you never got it done. Your doctor is even on some bullshit. You found the courage to go, and the doctor didn't even do it, and you're not gonna ask because you don't want to look like you want his hand up your ass. No kind of way. You feeling me on this? You got doctors that will not ask. I can feel this cancer. It is so easy to feel. It feels like a very hard brick or rock in your body. It's so easy to diagnose with your fingers. It's so easy. Now, if I feel what I feel, then you can have a PSA. So together, they make a perfect pair. But if you gotta choose one, you know, like on a test, this is more. Because I can feel this cancer, so easy to feel. Breast cancer is actually harder to feel than this. This is easy to feel. There is nothing like it in your body that should be there. This is easy to feel. Okay? It's not about enlarged. It's the feeling of cancer. Hard, brick-like, pebble, hard rock. That's what we feel. Okay, so I want my babies to know that our men gotta go. And if you have a daddy, you're gonna have a conversation with your daddy. Okay? All right now, so that is your prostate cancer. Turn the page. What do you got, medications or something? Is that what it says? Yes. Just put on your PSA, because I want to put some cancers on here. Just make sure you know this PSA depends on the man's age. We used to say this. We used to say this. 0 to 4 within normal limits. But if you are 35, 4 is not normal. But if you are 72, 4 is normal. So this is what we say now. Let's look, because I love the bubbles on here. The bubbles actually help you a lot. It says the PSA range for healthy prostate is 0 to 2.5. What's your PSA range? And then they go over here and say something a little different. They say something a little different. They say, with my BPH, what does that stand for again? Benign. What is benign? Non-cancerous. So with my BPH, they gave me a 4 to 10 range, which was normal for that patient. Are you feeling me yet? That's why we can't do this no more. We can't do that no more, because we got normals for different people. And they said Sam's was over what? 20. Now, I don't care what your problem is, 20 is bad. Do you see where I'm going with this? My father was 11. He went early, but he was young, 40 years old, with 11. That's crazy. If he was 80 with 11 and had BPH, that might be okay. So he got diagnosed early. Okay, do you feel me on that? 11 at 40 is not the same thing as 11 at 80. That's why you gotta know the age of the patient. So PSA, you have to know the age of the patient. Okay, now, the patient with the benign prostatic hypertrophy will have a higher PSH. That's what that's telling you. The patient who is young that has a high PSA, an abnormal digital rectal exam first, right? We did that first, and has this, okay? This patient needs a biopsy, because the only way to diagnose is a biopsy. And you know this. You know that. That's cancer talk, right? The only way to diagnose cancer is a biopsy. Okay? Now, my dad got some radioactive seeds and was good to go. They monitored him. It came back, I don't know, 20 years ago, but it was a low grade. So they just said, you don't need any treatment. And he didn't. 20 years later, he's still doing great with that same number. It's low grade. Okay? What you need to be aware is, as long as we know, we can treat what we need to treat and leave things alone if they don't need to be treated. We didn't know that 50 years ago. We had no idea that some prostate cancers are better left untreated. We had no idea. Some are aggressive. They will kill you within 2 years. How do we know? We don't without a biopsy. Raise your hand if you lost a loved one to prostate cancer. It's not uncommon. You've got these hands up. How old were they?
My first father was like 86.
How old were they?
My grandpa was 76.
Okay, it is very common. Yes, baby.
My grandfather-in-law was in his 50s.
Yeah, didn't need to happen. I can almost promise you the screening probably didn't take place at 40. No one needs to die from this. You know what I compare this to? Cervical cancer. No one needs to die from cervical cancer. We do PAPs. We go every year or every 3 now, but these guys don't go every year, and it is every year. It is every year. Gotta know that. All right. Okay, turn the page. Now, on this page for these different medications for BPH, I need